You know that feeling, right? That burning sensation in your chest we all call heartburn. But what's really going on in there when you feel it? Today, we're going to break it all down, digging into the clinical guidelines to really understand the difference between a simple case of reflux and when it might be a sign of something more. So let's just jump right in with the big question. Is your heartburn just heartburn, or could it be something more? Look, it's a super common feeling, but figuring out the difference between an occasional annoyance and a chronic condition, well, that's the first and most important step to actually managing it.
So, what is happening inside your body when you feel that burn? It's really a mechanical issue. Just picture a little valve between your food pipe, that's your esophagus, and your stomach. Normally, it's a one-way street. But when that valve doesn't seal up nice and tight, stomach acid can splash back up where it doesn't belong. And that upward flow, that splashing, has a technical name: gastroesophageal reflux. It's the physical event itself, and it causes those two classic signs we all know: heartburn, which is that burning pain in your chest, and regurgitation, that really unpleasant feeling of acid or food coming back up into your throat.
Okay, and this brings us to a really crucial distinction. Having reflux every now and then is one thing, but at what point does it cross the line from just being a thing that happens into an actual medical condition, a disease? This chart lays it out perfectly. Over here, you've got reflux, the event. It can be occasional, it's a symptom. But on the other side, you've got GORD, and that's the disease itself. GORD is a chronic condition, and the big difference is that the symptoms are frequent, they're severe, and here's the kicker: it can lead to real complications if you just ignore it. So what's the official benchmark? Well, healthcare professionals consider it GORD if your symptoms are popping up 2 or more times a week, or, and this is just as important, if they're severe enough to actually get in the way of your daily life. That's the clinical line in the sand. And this isn't just about feeling uncomfortable. Get this. About 1 out of every 3 people who have reflux symptoms actually has some kind of damage to the lining of their esophagus. It could be minor irritation, sure, but it can also be more serious. And that's exactly why paying attention to these signals is so important. So, how do you listen to your body? Because, GORD doesn't always just show up as that classic heartburn. Sometimes the signs can be way more subtle and show up in places you wouldn't expect. First, let's cover the classics, the signs we all recognize: heartburn and regurgitation. These are the most typical symptoms, your body's most direct way of saying, hey, stomach acid is in the wrong place. But then you've got these other signs, the ones that are a little less obvious. Things like belching all the time, a nagging pain in your upper stomach, or something called acid brash, which is that awful sour taste you get when saliva and stomach acid mix. Ugh. And this is where it gets really wild. A persistent cough that just won't quit, a hoarse voice, even asthma-like symptoms, or your dentist noticing your tooth enamel is eroding. All of these can be linked back to GORD. That acid can affect your throat, your airways, even your teeth, and you might never make the connection yourself. Okay, now we need to get serious for a minute. The guidelines are really clear about this. There are specific red flags, symptoms that mean trying to manage this on your own is not the right move. These are the times you need to see a doctor. Please pay close attention here. I mean it. These are symptoms you absolutely cannot ignore. If you experience any of these, it's time to call a doctor. Period. This includes chest pain, trouble swallowing, losing weight when you're not trying to, or any signs of internal bleeding, like vomiting something that looks like coffee grounds or having black stools. Even just feeling constantly tired or dizzy could be a sign of anemia from the reflux. These are all huge red flags. And hey, it's not just about those major, scary red flags. Even if your symptoms aren't that alarming, if you've been trying an over-the-counter treatment for 8 weeks and you're just not getting better, that's your signal. It's time to see a professional. So let's say you do seek help. What happens then? What does a management plan even look like? The good news is there's a really clear, structured path that can help you find relief. For the vast majority of people, the main goal is actually pretty simple: symptom control. We just want to get you feeling comfortable again. For milder cases, that might start with simple things like changes to your diet and lifestyle. It's all about improving your quality of life. And your local pharmacist can be a key player in this. They usually follow a simple 4-step process. First, they'll assess your history and listen to your symptoms. Then, they'll work with you to develop a plan. They'll explain that plan clearly, and finally, and this is so important,
They'll follow up to review how you're doing.
Yeah, that follow-up is absolutely critical. The guidelines recommend checking in with a professional somewhere between 4 and 8 weeks after you start a new treatment. This is not a set it and forget it kind of thing. It's an ongoing process to make sure the plan is working for you. I love this quote from the guidelines because it really drives home an important point. While these guidelines give us a great framework, your treatment should always be personal. It's about a healthcare professional working with you to make decisions that are right for your individual circumstances. And one last but really important piece of context for you. The specific guideline we've been talking about today is designed for adults between the ages of 18 and 55. How this is all managed for kids or older adults might be different, which is yet another reason why getting that individual medical advice is key. So, we'll end right back where we started with the question. From a simple burn to a nagging cough, your body is constantly sending you signals. The real question is, are you listening? Because understanding what those signals mean is the very first step toward feeling better.